Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to welcome all the listeners to Al Mubarak Radio. Today, the show is how to stay well this winter and what to do if you happen to fall ill over the winter time. Furthermore, we're going to be talking about antibiotics resistance, and how you can become an antibiotic guardian. My name is Bilal Patel. I will be your presenter today. I am a pharmacist, medicines management pharmacist with the North Kirklees CCG. Um, and I have been joined today on the station by Adam Patel, who is a community pharmacist, Dr. Khalid Naeem, who is a local GP practicing out of Mount Pleasant Surgery, and Jane O'Donnell, Head of Health Protection with Kirklees Council. First of all, can I thank Mr. Al Mubarak and Al Mubarak Radio to give us this platform to send out our message. As you know, the winter is here, the cold weather is here, and today is about giving information on how to stay well this winter and what measures we can take, what we can do to make sure that if we do happen to fall ill over the winter time, we know where to go, where we can get help, and how we can look after ourselves. Also, today it is Antibiotics Awareness Day, European Antibiotics Awareness Day. So we'll be talking about the appropriate use of antibiotics, what antibiotics resistance is, why antibiotics resistance is a problem, and why it is one of the biggest threats facing them today. So without further ado, I'm going to introduce Dr. Khalid Naeem. Like I mentioned, he's a local GP working in this area, also works and is a board member of the CCG. And Dr. Naeem will now talk to you about the national winter campaign that we have going on, how to stay well this winter, and give you some information and some pointers of what we can do to help ourselves over this winter time. So, Dr. Naeem, without further ado, if I can just introduce yourself. So, we know now the winter is here. It's cold, early nights, dark nights, raining, wind, sleet, snow, everything. So what are the measures that people can take, or what information do we have on how we can keep well this winter? Steps we might be able to take to ensure that we don't fall ill.
Assalamu alaikum, everybody. Thanks for inviting me to speak about staying well this winter. And thanks to Mr. Al Mubarak of inviting all of us to talk about the health issues during winter. Winter is a time when the health problems get quite aggravated, especially people who are vulnerable, people who are elderly, 65 years and above, people who suffer with chronic illnesses. They are at high risk of getting common infections. The cold, damp weather, icy weather, high winds, it all aggravate our existing health problems, and it is especially serious for people who are elderly among us. It can increase things like blood pressure, heart attacks, and strokes. In these weather, the main aim of stay well, stay warm in the winter campaign is to raise awareness about how we can keep ourselves at low risk of developing any infection or any aggravation to our existing illnesses. And we need to make sure that we ourselves are warm, and also our parents, our neighbors, our elderly relatives, they are all in warm, comfortable conditions, and they're all stocked up with their winter supplies. Their medication is up to date, and that they somebody is there to keep an eye on them to find out if they are comfortable in their home.
Okay, so we talk about staying well this winter, as Dr. Naeem mentioned, very important for the elderly or those who are immunocompromised. Immunocompromised means that your immune system isn't working as well or isn't as strong as it should be. So we need some help there. Would I be right in saying this, Dr. Naeem, about immunocompromised patients, and these people are extremely vulnerable at a time like this?
Yes, I agree. People who have got chronic illnesses and elderly people, their immunity levels are low, and my colleagues are going to talk about vaccination. Vaccination is important in winter months, especially flu vaccination. There is also a campaign about pneumonia vaccination, and I'll let my colleagues talk about it. But you need to make sure that you are prepared for winter with all the required vaccination and your medication.
In the winter, we know we get this cold snap and cold weather comes in. We're amber right now in the region as well with regards to winds and certain storms which are heading over here, Storm Abigail, and they have wonderful and weird names nowadays. Staying warm is a very big campaign, and staying warm is something which is information which is out there on how we can stay warm. Why is this important for people, especially during the winter, and what measures can we take in regards to this?
Staying warm is important because, as I said earlier, being cold can raise your risk of getting infections, increase in your blood pressure, increased risk of heart attacks and strokes, and that's why if we are warm, then we are protecting ourselves from these risks.
Right. So like Dr. Naeem said, very important that we keep ourselves warm, especially if we're going to go out. Sometimes we think we're only walking down the street to the local corner shop or something, so we don't need to be wrapped up that warm. But it's very, very important that we wrap ourselves up warm, especially the elderly and these immunocompromised patients. Very important that we wrap ourselves up when we're going to go out. And, we need to be mindful of the other people around us as well. So if we have elderly, neighbors or in our local community, then we should try and keep an eye on them as well. So if we're going to, maybe pop down to Asda, just, a polite knock and just ask them, can I get you some milk or some bread, so they don't have to necessarily, make that trip and go out in this cold weather when they are more vulnerable to get this milk and bread, which then might lead to them getting a cold or the flu or something, or being unwell. So this is something that we need to be mindful of. Also, part of this Stay Well this winter campaign is about where we can get help. So I'm going to ask Adam Patel, who's one of the local community pharmacists, to come in on this as well. Adam, we talk about staying well this winter, colds, flus. Where can we get help? How can community pharmacy help during the winter time? If I can just bring you on that, please.
Yeah, hello, everybody. Ways pharmacists can help so much to patients this winter. If we can briefly just look at some of the services that we deliver and provide as pharmacists to patients decide where to go and when the medical assistant can help. Pharmacists one-stop place for health advice. Pharmacists can help with a range of common conditions and major injuries, such as general aches and pains, managing cold and flu symptoms, to even skin rashes. So if you have any of these common conditions, your pharmacists are in the right position to give you advice and medicines if needed. And also, I think we are in a wonderful position to maybe refer particular patients to other professionals like doctors and hospitals if needed. I think pharmacists can also provide and promote health and well-being. And we provide access to smoking cessation clinics, sexual health, alcohol support. We could also help people make healthy lifestyle changes, especially in the winter, with regards to helping them change their diet and maybe looking at exercise levels in the winter months. I was going to say pharmacists are sort of trained experts in the use of medicines. We can advise on the safe use of prescription and over-the-counter medicines this winter, and we can help people manage their repeat prescriptions so that they don't run out of their tablets over the winter period. And we can offer either reviews of medicines in terms of making sure they're taking the tablets effectively.
Thank you very much for that. Like Adam said, it's very important that we understand and we realize that pharmacy is something and is a place where we can go to and we can get professional help. These pharmacists, they're professionally trained, they're trained in medicines, and they know the different illnesses as well. So they'll be able to offer you help during the winter season. And like Adam mentioned, very important that we keep stocked up with our regular medication over the winter time. Bank holidays are coming up, Christmas, Boxing Day, pharmacies are closed, and lo and behold, there's so many people who become quite perturbed because they don't have their medications. They've run out, they didn't realize. So over these days when doctors are closed, pharmacies are usually closed, we become a burden on the NHS because we have to go to places like A&D and an NHS 111 to get our medication, where we could have just got our medication if we were if we kept it in mind and if we were a bit more organized. So pharmacy is someone who can help with this. Get many calls during the winter season that I don't know what to do. So it's very important that we make sure that we use our pharmacy and we use the expertise there to get help this winter. If I can bring Dr. Naeem into this as well. We talk about patients visiting pharmacy, visiting the GPs, visiting A&E. There's many places out there where people can go. NHS 111 is something else which they can contact. When or how do they differentiate of which service they need to contact? What would your thoughts be on that, please?
That's a very good question. Whenever we are not sure what to do in any illness, we need further advice, and for that further advice, depending upon the severity and the urgency of that condition, we need to decide in our mind which is the best place to visit or to seek advice from. If they're the common conditions, and we just need advice, small injuries, cold and coughs, and or any aches and pains, then try to self-manage, and if we need further advice, then 111 service, NHS 111 service is the best place to seek advice. They can signpost you to either self-care, give you advice, or they can tell you to go and see the pharmacist for minor ailments, or they can ask you to go and see your GP about certain conditions. Going into A&E for minor things actually causes more issues than it solves. It stops a lot of people from getting or help who actually need urgent or emergency help from the accident emergencies. The name actually implies the accidents and emergencies. So we should make sure that we only visit accident emergencies if it is extremely important to do so. For common ailments, we should avoid going to those places. We should seek advice from NHS 111, our pharmacists, and if it is beyond their scope, then your local GP.
Thank you. So like Dr. Naeem said, just to quickly recap, A&D, it's for more serious conditions. And when we go there for minor ailments, which we could have seen our GP about, or we could have seen our pharmacist about, or we could have called 111, get some advice from there. Maybe we didn't need to see anybody. Maybe it's just something that they could have given advice on, of how we can treat ourselves, how we can stay well, how we can self-care. So all this, if we put all this together and we end up at A&D, then those people who really need the help of those at A&D and of those departments, we're taking away from them. And it's life and death matter for some people, because you're being seen, somebody else who's a lot more serious cannot be seen, or the ambulance cannot get there, and because of that it puts them at further risk. So it's very, very important that we keep in mind that it's not only us. The A&D is for other people as well, and there are a lot more serious people out there than the cold and flu that we might have. So because of that, make sure that we only use A&D when necessary. If I can bring you back, Adam, people are sometimes concerned that they go to pharmacies, or they might go to a pharmacist, speak to a pharmacist, but their condition might be more serious than what a pharmacist, or what is in a pharmacist's remit. So what would you say on that? What would pharmacy do, or how can pharmacy help if someone's condition is more serious than that? Do you have means of signposting and sending them elsewhere?
Absolutely. It's a very important point that we've just been raising, trying to save valuable resources within our area in terms of A&E. I would always encourage patients to come to the pharmacy first, because we are trained professionals, and there will be instances where we wouldn't know what to do, or maybe in a position where we may need further help ourselves. In that case, we would always refer, if necessary, towards a doctor or to A&E, depending on what presents itself to us in the pharmacy. But there are always certain conditions where we would always advise people to ring 999. And if I could just maybe spend a minute or so just to tell everybody, these are the sort of conditions that we would like people to go to A&E rather than come to the pharmacy or to a doctor's surgery. And a couple of things I wrote down just to sort of help me is, please only dial 999 if someone has loss of consciousness, if they fainted or passed out. Again, if they're epileptic and their fits are not being controlled or keep going, ring 999. Again, we'll always advise people with severe chest pain, or if anybody thinks they're having a heart attack or a stroke, contact 999 straight away. Also, anybody with breathing difficulties or severe bleeding, they're the sort of people that we would refer straight away, and hopefully they'll get better treatment from the A&E departments. What we should do is only use the A&E departments for life-threatening and critical conditions. Sometimes people end up in these departments with minor sprains, minor burns, which I'm sure many pharmacists can deal with quite appropriately in their own environment. I would just like to take the opportunity to sort of talk about, there's loads of different people with different professionalisms, different structure of care they can deliver. It's just making sure that the patient knows which one to go to first. If any doubt, please ring NHS 111 and you'll be signposted correctly.
Thank you very much for that. So whilst Adam was speaking, something he talked about is breathing problems. And just like to take this moment to say, those people with asthma, COPD, it's very, very important that you have your inhaler with you, especially those that use the brown inhaler, which you take morning and day, but the blue inhaler, which you take when you start feeling breathless. It's very important that you carry that with you, especially in the cold. If the cold gets to your chest, it's going to impact on your breathing, and it's going to make your breathing maybe difficult. You might be at risk of more asthma attacks, if I can call them that. So it's very important that you keep your inhalers on you at all times. Even if you think, I'm just running down to the shop, it's only at the end of my road. Very, very important, because lo and behold, most often than not, we're trying to rush, try and get something quickly. And when we're rushing and it's cold, then we might have an onset of an asthma attack. So very, very important that all those who are asthmatic with breathing problems, COPD, whatever you might have, very important, keep your inhalers with you at all times. Make sure if you haven't used them throughout the summer months for a long period of time that they are full, they are working. If not, make sure before the winter hits, before the cold temperatures hit, you contact your pharmacy, your GPs, you get your prescription and you get your inhalers in. Otherwise, what happens is we get an asthma attack, it gets worse, and we end up at an A&D. And once again, it's not what we were talking about. That's something which could have been totally avoided, can be will end up in large expenditure for the NHS. Just before the break, Adam, if I can just ask you, what do you recommend people, keep at home, keep stocked up, which might help them over the winter time?
Sure. There's a couple of things that we would like people to sort of make a note of, and that's mainly to treat colds and flus. The best treatment is usually simple painkillers. So please try and keep some things like paracetamol, ibuprofen, aspirin inside your medicine cabinet. But always be careful and be mindful that it is going to be still suitable for you to take, because sometimes people under 16, they can't take aspirin. If you're pregnant or breastfeeding, you should try to avoid this as well. Sometimes people keep decongestants within the medicine cabinet. Again, that does help with sinus congestion, but again, it's very limited use really, and we don't promote this long-term use more than 7 days, only because the congestion will only just come back again and we're back to square one. Other things I was thinking about that people should really sort of think about keeping are sort of hand gels, wipes in the house, paper towels, because when you get a cold, it's very important that you use the tissues and you dispose of them straight away into a bin. And maybe instead of sharing towels, maybe purchase some paper towels, so when you dry your face and your hands, you could dispose of them quite quickly and run less risk to passing on the virus to your family members. We can talk about keeping an eye on your regular tablets, so make sure that you don't run out, because sometimes when you're ill, that's a time when people tend to forget to put their request in, and that brings burden onto our doctors and the pharmacy itself. Other things, especially thinking about children in the winters, that's important. Again, have regular stocks of liquid paracetamol, liquid ibuprofen, maybe invest in buying like some Saline nasal drops, which are fantastic for unblocking little nostrils and hopefully keep you parents a good night's sleep. They're quite cheap and very easy to use, and again, can alleviate a lot of the symptoms that your baby or your child may suffer from.
Thank you for that. So like Adam said, very important. There's few things that we can keep in. He talked about paracetamol, ibuprofen, even for kids, saline nasal drops. And this is something we need to keep in mind. It's something which has, generally speaking, if we don't buy out of date stock or short dated stock, it's something which will sit on our shelves for a long period of time. So it's not something which is going to run out or go out of date quickly. So it's quite important that we try and keep these things. Adam talked about hygiene, wipes and stuff. Very important, especially when we do have a sneeze or a cough or a cold, that because we'll be using stuff that other people will be using, we wash our hands, make sure that we're trying to keep as clean as possible, try and keep our surfaces and everything. So these wipes and these hand gels and everything which are out there, very important that we try and keep some of these as well. And we're going to go to a break now. We will be back after this short break, so join us again on Al Mubarak Radio. You can follow us on Twitter at Mr. Al Mubarak. You can follow us on Facebook and YouTube channel Al Mubarak Radio, and you can also download our app on Android and iPhone. So welcome back, listeners, to Al Mubarak Radio. Like I said, you can follow us on Facebook at Al Mubarak Radio, on Twitter at Mr. Al Mubarak, YouTube channel Al Mubarak Radio, and you can also download our app Al Mubarak Radio on Android and iPhone even. Actually, I've just got a text in right now as well from certain Mr. Shahid Patel, and it's something that we're going to cover as well. So thank you very much for the text, Shahid. He's asking, what are the differences between flu and the common cold? So Adam, if I can bring you on in on that,
sure.
Differences between flu and the common cold, and take it away.
Okay, nice to be back. Flu is a misconception. People always think that flu is just a bad cold, but each year thousands of people pass away due to complications of catching the flu. There are some subtle differences between cold and flu, and people will know the difference if they have ever suffered with the flu as opposed to a cold. Colds, the main symptoms of colds are you get a runny nose, beginning with clear mucus that sometimes gets much thicker and green as the cold progresses. You do end up with a blocked nose, sore throat, there's sneezing, and maybe a slight cough as well. People with a cold also suffer with a mild fever, tiredness, and headache, and symptoms usually develop over 1 or 2 days and gradually get better after a few days. But some colds can last up to 2 weeks. Okay. The flu, a bit different, because flu you get a much quicker onset. So a flu will develop much quicker than a cold will. You also get a sudden fever, usually 38 to 40 degrees Celsius. There's always muscle aches and pains, and that's one of the biggest differentiation we can actually look at between colds and flu. There's obviously excessive sweating with the fever, and most people with the flu will tend to feel really exhausted and need to lie down and rest all the time. You may also get a dry or even a chesty cough with the flu. The person with the flu may also have a runny nose and be prone to sneezing, but they're not usually the main symptoms of flu. So there are subtle differences between the cold and the flu. Mm-hmm. With the flu, they are generally more dangerous and may need treating.
Thank you for that. So like Adam said, it's very difficult. There's very, very small changes between the cold and the flu, but it's something that we need to differentiate between. The cold, like Adam said, it has a slow onset. Starts off runny nose, clear mucus, gets thicker, gets worse gradually. And flu, it has a much quicker onset. So one day you're feeling a bit lethargic and not well, and the next day, that's it. You're feeling really unwell. It's hit you really hard. You're feeling energyless. You can't get out of bed. Muscles aching, paining. So it's very important that we try and differentiate between the two, especially because if we don't differentiate between the two and we do have a cough and a cold as opposed to the actual flu, then we could end up at the GPs when we could have just actually gone down to the pharmacy, the painkillers, man flu, another thing which is very important. There's two options: either we man up and take some ibuprofen, or turn into a woman. I don't know what you quite want to do. But yes, so thank you very much for the question, Shahid. We've got a few other questions as well. Thank you for the questions, listeners. We will pick these up later on as we feel they are relevant. So do keep texting in on 07868 476 577, and we will try and answer as many questions as possible. I'm going to introduce and call in Jane O'Donnell now. Like I said, she's the head of health protection and she works with the Kirklees Council. So going on from the cold and flu stuff, Jane, who would be eligible for the flu vaccine, for the free flu vaccine? So if we can have some information with regards to that, please.
Yeah. Thank you for inviting me this afternoon. Individuals who are eligible to receive the free flu vaccine is people aged over the age of 65 years, pregnant women, and that's all pregnant women in any stage of pregnancy. So, you know, throughout pregnancy, while the flu vaccine is available, pregnant women are eligible to receive. All 2, 3 and 4-year-old children are eligible to receive the vaccine. And also from this year, children in school years 1 and 2 in primary schools should also receive the vaccine. Also, people from the age of 6 months to under 65 years or in a clinical at-risk group. So these include people with long-term respiratory disease such as severe asthma, chronic obstructive pulmonary disease, bronchitis. If you've got chronic heart disease, chronic kidney disease in stages 3, 4 or 5. If you obviously suffer from chronic liver disease, if you've got Parkinson's, motor neuron disease or learning disabilities, you should have your flu vaccine. People with diabetes, if your spleen doesn't work properly, and we spoke about people with a weakened immune system before, so if you've treatments for cancer or you've HIV or AIDS, you should ensure you get your vaccine. And carers, they're another important one because obviously they need the vaccine to care for people with long-term conditions. And we also shouldn't forget those who live in long-stay residential care homes as well. And what also is important is people who are frontline health and social care workers. They should receive the vaccine via their employer, though.
Right. Thank you very much for that. So just to quickly recap, Jane was talking about कौन है free NHS flu jab मने किसको मिलता है free NHS flu jab और क्यों लेना चाहिए. तो young children 2 to 3 4-year-olds, school years 1 to 2, और जिसके पास ऐसी बीमारी है जो उसको उसके इम्यून सिस्टम को वीक कर देती है, तो उन लोगों के लिए भी बेहतर है तो वो फ्लू जब ले ले. तो ये लोग कौन हैं? तो लोग जिसके पास आस्मा है, COPD, ब्रोंकाइटिस, जो लंग्स की डिजीज, ब्रीदिंग की डिजीजेस होती है, वो लोग के लिए, और जिसके पास क्रॉनिक डिजीज है. क्रॉनिक का मायना क्या है? तो उनके पास काफी देर से है और वो ट्रीट उसको करना मुश्किल है और उसके लिए कोई क्योर नहीं है. तो किडनी डिजीज है, क्रॉनिक हार्ट डिजीज है, लिवर डिजीज है, ऐसी चीज़ों जो आपके पास होती है, तो फिर फ्लू जब आपके लिए भी फ्री है और आप ले सकते हैं. और जिसके पास डायबिटीज है और जो केयर होम्स में या वो लोग जो काम करते हैं सोशल एंटरप्राइज में, सोशल केयर में, या हेल्थ वर्कर्स है वगैरह, तो उन लोगों के लिए भी फ्री है. तो इम्पोर्टेंट है आपका फ्लू वैक्सीन, आपको डॉक्टर, आपका GP भी आपको बताएगा. अगर आपके लिए फ्री है तो बहुत अहम बात है कि आप कोशिश करें. That we try as much as we can. We ask our GPs, am I eligible? Some people might not know whether they're eligible or not. So it's very important that we ask our GPs. Receptionists will be able to tell you as well whether you're eligible for a flu vaccine. And going on from this, why is it important that we have the flu vaccine and we have it each year? You know, some people, I've got a text here as well from Faiz Patel. Thank you for your text, Faiz. He's asking, why is it important that we take it each year? If I've had it 1, 2, 3 years ago, why do I need it again, basically?
Yeah. As we spoke about earlier, flu causes severe illness and deaths each year, particularly amongst people who have got long-term conditions and in the clinical at-risk groups we've just spoken about, older people, pregnant women. The vaccine is actually offered each year before it starts to circulate, because the virus actually changes each year. So obviously the vaccine is manufactured to what is actually circulating. Normally looking at the Southern Hemisphere to start with, and vaccine production starts to then see what strains have been circulating. So what was circulating last year, the vaccine probably wouldn't protect you from what was actually going to be circulating this year. So it's very important, because of how the vaccine the virus continually changes, to why the vaccine has to be given each year.
Thank you very much for that, Jane. So, like Jane said, the vaccine, it might be a small change every year from the viruses, but because of that, it might mean that the vaccine that you had last year or the year before won't be effective. So that's why it's very important that these people have their vaccine, flu vaccine, every year. Another question which is quite prominent nowadays is, will the flu vaccine give me flu? Will I end up getting flu with the flu vaccine? Are they giving me the flu?
The vaccine is made from an inactivated virus, and it can't transmit the infection. And so people who get sick after having the vaccine would have got sick anyway. So because it takes a week or two for the vaccine to actually give you protection. So people wrongly assume that because they got sick just after having the vaccine, that it was because of the vaccine, but they would have got the illness anyway, even if they'd not had the jab.
Right, thank you very much for that. So like Jane has quite well explained, the flu vaccine doesn't give you the flu. We're not trying to get rid of you. They're not trying to wipe you out. It is if you were going to fall ill anyway. So it's very important that we do have the flu vaccine. They're not giving us the flu. They're just giving us something that our body can work up. So it's like mobilizing something. So when we be given that flu vaccine, we're ready. So when that flu virus comes, our body is ready to fight it. We all have all the mechanisms there to fight the flu already. I think this is a question for both Adam and yourself. As well as protecting against flu, what else can the public do to stay well? And we talk about staying well this winter and self-care. What else can we do to stay well?
Well, we spoke about earlier making sure we eat plenty of hot foods and drinks, and obviously make sure you include your 5 daily portions of fruit and vegetables. And this can include also tinned and frozen foods. So obviously make sure we stock up on some tinned and frozen foods. That'll help us not being able to go out when it's icy and cold. And we also need to look at as exercise as well. So making sure that we exercise probably every hour. Not that we're saying start doing marathons, because obviously any exercise plan, if you've got a long-term condition, you should discuss with your GP before you start exercising. Wearing lots of thin layers of clothing, clothes made from cotton, wool, or fleecy fibres, are good to maintain body heat. And obviously making sure that you've got your gut-fitting slippers and your shoes, what have got good grips on, so to prevent slips, trips and falls. So, looking after yourself. And Adam, as he spoke about, ensuring you've got spare medication. You're up to date with your medication as well. We also, I think we need to look at how we make sure we keep us home warm as well. Making sure that your heating system and your cooking appliances have been checked, and keeping your home well ventilated. Obviously, if you have an electric blanket, use it correctly as the manufacturer's instructions, and certainly don't use a hot water bottle at the same time. I understand that you should have an electric blanket. I think it's tested about every 3 years. And obviously don't use your gas oven or your cooker to keep your house warm, because obviously there's then the risk of carbon monoxide poisoning. And obviously keep your house warm by sealing your windows and doors, draft excluders, gaps around, as say, your windows, loft insulation, and making sure that furniture's away from your radiators. And I read a good tip the other day about making sure pulling your curtains on when it comes to dusk to keep the warm thing as well.
Thank you very much. So a lot of information that was given there by Jane. And a lot of this information we can find on certain websites, which we will be sending out via our Facebook and Twitter feeds. So keep an eye on that as well. Like Jane said, important the foods that we eat and the right foods that we eat as well. Mentioning the 5 portions of veg and fruit a day. And no, strawberry cheesecake does not count as one of your portions. And once again, staying active, trying to do, of course, we can't go for long walks and stuff when it's snowing and when it's, so even if we try and just stay active, even if it's 15-20 minutes, you do a little bit of a workout at home or at the gym, or just trying to stay active, because the more you laze about, or especially when you're ill as well, if you're feeling unwell and you like they say, sweat it out, or you try and stay active, then that will improve our mindset. Healthy mind, healthy body. I think that's something that we can take away from this as well. And like Jane said, there's a lot of tips out there as well, keeping furniture away, closing our curtains, making sure we keep our houses warm as well. There is help for people that they can get out there as well via your councils and via other means. So look on the government websites with regards to that as well. If you are having problems paying your bills or financially in difficult times, then we can get help from them as well. And if we can't, or if we don't want to warm up the whole house, then especially the rooms that we're going to be sitting in, using them more. So maybe in our bedroom, make sure it's nice and warm before we get into bed, or in our sitting room where we watch TV or where we sit around majority of the time. We're making sure that those rooms that we're staying in the most are being kept warm as well. One of the questions that has come in is with regards to the flu vaccine is, where can I have my flu vaccine? Where can we have these vaccines? Is it free from everywhere? Is one of the questions which has come in. And if I'm not eligible for a free vaccine, can I still have it?
Obviously, if you're eligible for a free flu vaccine, you can get it from your GP. Quite a number of community pharmacists now deliver the flu vaccine. If you're pregnant, your midwife. Obviously, if you're not eligible for a free flu vaccine, then there's a number of pharmacists what actually do offer the vaccine, but you have to pay for it.
Mm-hmm.
And depending on where you go for it, it obviously depends on what it costs. Yeah, so just because you're not in an at-risk group, you can still obviously have the vaccine, but you will have to pay for it.
Thank you very much for that. So like Jane said, just to quickly recap, that those people who are not eligible for a flu vaccine doesn't mean that you can't have the flu vaccine. All it's saying is that you're going to have to pay for the service, depending on the pharmacy that you go to, depending on what how much they're getting it in for and what they're charging. Charges will be different, but it's not mega expensive, as I recollect, Adam. It's not.
It can vary. Do talk to your local pharmacy, but in the region between £10 to £15 is kind of reasonable.
Right. So, like Adam says, in the region of £10 to £20, those people who can't have it free, this is the charge that you're probably looking at. And thank you for your text regarding that, Majid from London. Before we go into another break, where can people find information with regards to the flu vaccine and with regards to flu and everything this winter? Adam, there's services that pharmacy, is it something that they can give to you, or where can basically people go to find help?
Well, people can pop into any of our local pharmacies. I'm sure will be of great benefit to them. There's also a government website, if I can maybe give out the address.
Yeah.
It's www.gov.uk/keep-warm. I think this will be repeated after our show has ended, so people who did get that can catch on later on. But also, if I could just take this opportunity to tell our listeners of a new website. It's for people who live in our Kirklees area and who also suffer with a long-term condition, which may cause things like pain, breathing problems, anxiety. There's a lovely website, and if people can log on to www.myhealthtools.uk, they'll find that My Health Tools will support you to gain access to a range of services, tools, resources, and knowledge to help better manage your long-term conditions and improve your health and well-being, especially in these winter months.
We are going to go to another short break now. We will be back with Dr. Naeem, Jane, and Adam again. So keep your texts coming in to 07868 476 577. Once again, you can follow us on Twitter at Mr. Al Mubarak, follow us on Facebook at Al Mubarak Radio, YouTube channel Al Mubarak Radio, and you can download our app Al Mubarak Radio on Android and iPhone.